Hey guys, this is Cooper with the Dirty First podcast. So I've kind of been looking at my schedule and realized that I won't have as much time for doing interview type content right away as I would originally have liked to. However, I'm going to do some other content that I find interesting. I'm going to try and do some unbiased news reporting and stuff like that. And I won't even say reporting. I would like to take some news articles from left-leaning sources or right-leaning sources. I sit politically libertarian. However, for the purposes of this, I would really like to stay apolitical and just kind of share the news and what is going on, and don't bring my own political bias into it. And just kind of talk about what's going on. Um, and I also would like to share little segments in different areas that interest me as well, and stuff like nuclear science, maybe a little bit with the automotive industry, and electric cars and stuff like that, and the new age technology. I think that would be really fun. Um, I definitely would like to do some stuff involving music and talking with artists, or talking about music, and maybe even doing music reviews. I've even thought about seeing if I can do talk throughs with books, or just reading books for audiobooks. So we'll kind of see where that goes. So in the meantime, I'm going to kind of lead you into what we got going on tonight. So I have three little articles that I've kind of just read over and took the short and sweet of, and I will kind of talk about, and just you know um, read up my little short and sweet bits of information I have on them. There's also some articles and some other information with them also I'd like to share. Um, and I will take screenshots of the news articles and put them on the screen during the for YouTube as well. And I will also for audio listeners, if you would like to look at the links later on after you're done, or if you're driving or whatever, what have you. I will have all those in the link down below, in the description down below. So, without further ado, let's get to the news. So I have three segments going on tonight. Two are about the COVID crisis going on in North America, and then I also have another segment about some stuff going on. A mysterious fever occurring in India. 60 people have died in a week, and yeah, it's kind of scary. So the first article is America's COVID medical bills are set to rise, and I'm gonna see if I can't get that up on my screen while we're talking about it. I really should have just prepared a lot more for this ahead of time, but we're just gonna go on the whim. But anyways, okay, right here. So it's an article I found from medicalexpress.com. It it was posted September 3rd, 2021, which and the day of recording was yesterday. Uh, and here's the short and sweet on it. Insurance companies' temporary waivers on costs associated with treating COVID-19 are expiring, causing care to become more expensive. Early in the pandemic, many didn't have a copay associated with their ER visits or COVID-19 related stays. Tests were free as well, as um, listed by a New York Times article as well, that I will, let's see if I can get that guy on the screen as well. Da, 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 da. Sure, we'll pop that guy open too at the same time. Let that be. So we'll get back. Federal law still requires insurers to cover testing at zero cost to the patient when they have a medical reason for seeking care. As many Americans are now seeking out testing for monitoring and don't qualify for coverage from insurance. Some patients have received bills for as high as $200 for routine screenings, according to patient documents submitted to a Times project tracking the cost of COVID-19 testing and treatment. So that's very, I understand it's a pandemic, and that's a very kind of, it's a wishy-washy slope we're on, and it seems like we're on it's a very slippery slope, but everyone's tensions are high. You can even hear the baby screaming in the background. Apparently their tensions are high too. But yeah, no, it's just a friend of mine staying over, and his daughter is just downstairs in the basement. So insurers are confronting the question about whether or not the question. Uh, Insurers are confronting the question about whether the question about the okay, I messed that up. Insurers are confronting the question about whether the costs of COVID treatment should fall on the individuals who have chosen not to get a vaccine. Cynthia Cox, a vice president at the Kaiser Family Foundation, who has researched how insurers are covering COVID-19 treatment, told the news. That's very, as currently I don't have a vaccine. I'm not saying I'm not going to get it. However, I'm I'm just waiting until there's more information about it. As much like anthrax was with the war in Afghanistan and whatnot, and how it caused a lot of issues. I kind of wanna wait a little while personally until I get it, until I see some more science behind it, because it did just get FDA cleared, but I still don't really trust it much, and I should probably talk to my doctor, and get a medically get a someone with some valid medical opinion to really help me make the right choice. And at the end of the day, it ends up being my choice. But I definitely don't think that is really, that seems to be a very like kind of wishy-washy thing to say. That seems very, I I stretch to say kind of mean. This is kind of mean. Unvaccinated people could also face other increased costs as well. Delta Airlines and some other businesses plan to charge unvaccinated workers higher rates for insurance. So I remember running across that one in, let's see, um, other other readings, and I even heard a little bit from uh, Tim Pool. He's a another YouTuber I listen to. Oh, come on. Okay. Well, I guess I can look at that New York Times article. So we're gonna pull up the one about Delta. Come on, come on. Work with me now. Come on. See, cool. Yeah, this is running two computers at the same time is not my not my cup of tea. Where are we at? Okay. Guess we're going over here. Man, this MacBook is really, it's on the struggle bus, for real, for real. Um, come on, any day now, any day now. But yeah, basically while this is loading, the short and sweet of the article was that Delta Airlines is now charging their now raising insurance premiums, I think, by around $200 for unvaccinated employees. Um, that definitely seems like, and to be honest, my personal opinion idea kind of went out the window. I'll have to throw my opinion on some things to be able to push my point or be able to push any sort of idea. But that kind of seems like, and it seems like a lot of people are making second-class citizens. The same thing that goes for, and as I've gotten older, my opinion even just on abortion and stuff like that, and rights for women along with that. I I really think this is starting to turn into like making unvaccinated people or people choosing to not get vaccinated, um, like second class citizens. What if you can't get the vaccine, for a health reason? What if it's not available for your area? Um, what if you just choose not to get it? Because it's, as an American citizen, that should be all right, is to be able to choose whether or not to get it. Um, okay, so this is from Delta News Hub. Delta to require new hires in the U.S. to be vaccinated against COVID-19. This was posted by a staff writer, May 14th, 2021. So it's a little bit older, but I have another article I'll also list as well. Delta knows the vaccines are the best tool available to protect one another and bring an end to the pandemic. And the airline has made great progress to achieve herd immunity within its workforce, with more than 60% of its employees already vaccinated. To help maintain this trajectory, Delta will require all new hires in the U.S. to be vaccinated against COVID-19 unless they qualify for an accommodation, effective May 17th. So that seems, well. I mean, there's a lot of places like schools that require vaccines for children. So it's that's not, I guess, uncommon to require vaccines. In the military. It was required that I get a certain amount of vaccines when you work for certain companies. Certain places you have to get certain vaccines, but I don't think that a vaccine should be required for you to be able to go and get groceries or gas or go into a restaurant or get a job. Um, and I don't believe that, um, and I could share a little bit of information on it, but vaccines being available at sporting events. Like, I know that I heard about the Raiders uh, wanting their fans to be vaccinated and having vaccines available outside, and I've also heard here in Minnesota with vaccines being available at the Minnesota State Fair. Like, should a should a vaccine really be available and being done at a state fair? I guess it's a very, like, strange place to have it. I I don't know how to feel about that. It's very confusing. I'm very confused. Okay, Delta, and all right. So this is an article from NPR.org, posted August 15th, 2021. So a little while ago. Delta Airlines is going to start charging unvaccinated employees $200 per month. Um, Delta Airlines will charge employees in the company health plan $200 a month if they fail to get vaccinated against COVID-19. A policy the airline's top executive says is necessary because the average hospital stay for the virus costs the airline $40,000. CEO Ed Baston said that all employees who have been hospitalized for the virus in recent weeks were not fully vaccinated. The airline said Wednesday that it will stop extending pay protection to unvaccinated workers who contract COVID 19 on September 30th, and will require unvaccinated workers to be tested weekly beginning September 12th, although Delta will cover the cost. They will have to wear masks in all indoor settings. Delta stopped short of matching United Airlines, will require employees to be vaccinated starting September 27th, or face termination. That's kind of fucked up. That's really fucked up. However, the $200 a month surcharge, which starts in November, may have the same effect. Wow, that's that's a little crazy. That's a lot. That's a lot going on there. Uh, Research. Okay, so a longer stay that includes hospital time in the ICU involving COVID-19 or a helicopter transfers can cost significantly more than the estimated 40. I've seen it costs around 40 to 50 grand, but it seems like the general consensus is around $40,000. for a COVID-19 stay for the average person. Uh, yeah, that's let's see, what else do we got? I have two more on um, from CNBC, which I think I'll just throw on the screen for a little while, and then I'm gonna pull up one here from it's another article from Healthline. Okay, and then kind of okay. So yeah, okay. So Healthline. This is posted. Did I just read from this one? When was this posted? Okay. I will let me scroll down here a little bit further and see if I can find when this is posted. As I would like to mention information that's kind of relevant and not just not if I have to get older information, at least let it be kind of relevant to what's going on currently, because obviously with the times and stuff changing, new information and stuff always changes. So it doesn't look like I'm able to see the when this guy was posted quite yet. However, see when I see it in the article, I will bring it up. But it's a article from Healthline. Unvaccinated workers may soon pay more for their company health insurance. Most companies will continue to have the right to choose whether or not to get vaccinated against coronavirus, SARS-CoV-2 that causes COVID-19. However, employees who decide not to get vaccinated could face higher health insurance premiums. Many employers have tried offering incentives in order to encourage vaccination amongst employees, including cash payments. But Delta recently took a more aggressive approach when it announced that unvaccinated employees will be subject to a $200 a month premium surcharge on their company provided health insurance. Surveys show that people in the United States are split on whether or not unvaccinated workers should pay higher insurance premiums. For employers, however, the cases for pushing employees to get vaccinated is clear. So that, again, like, why? What is the, like, if people don't want to get this vaccine or are not trustworthy of it, or don't, are hesitant, whatever you would like to define it as, just offering them money and just offering them a check isn't gonna, like, if money isn't always gonna change everyone's mind, and like just erroneously printing dollar bills and just like outlandish, wildish spending is also not gonna help the United States or anybody else going on right now. It's not going to really, it's not going to help anything. And it's. I mean, it's definitely going to do a lot more harm in the end, because, well, if if you study economics and you study how things happen, sometimes when there is more, it is worth less. But what do I know? Anyways, yeah, I really think that's kind of messed up. What some airlines are doing, and I don't think it should be the um, government's big thumb on people's lives. Ooh, sorry, just had to get a drink of water. Had to take some multivitamins before bed. But yeah, we'll go on to the next segment I got going on here. Some vaccinated travelers are already getting COVID-19 booster shots, but experts say that may be counterproductive. International travelers have gotten used to getting tested for COVID-19 on their travels. However, the most worrisome things for vaccinated Americans is the test, which will often determine whether or not they can come home. Since January, all travelers must test negative within 24 hours of entering the United States. There have been many reports of both vaccinated and unvaccinated travelers testing positive within the last 3 days of their trip. And just so I can kind of go through this short and sweet, I'm gonna read out my little bits of information that I have first, and then I'll open up the other articles this time, and so I can keep on the screen a little bit longer. If a traveler tests positive for COVID, this often means that they must remain in their current location at their own expense under quarantine or isolation orders. U.S. travelers must get rested until they reach must get retested until they reach a negative test result. And if I could speak English today, to give themselves extra insurance policy, many fully vaccinated American travelers are finagling a third shot of the vaccine before leaving for their trip, even though the FDA has yet to give a booster shot on an official green light. Many simply present themselves as unvaccinated at pharmacies or other vaccine providers. Some get a booster with the blessing of their doctor. People are acting in their own self-interest, and that doesn't shock me, said Dr. Kavitya Patel, a primary care physician in Washington, D.C., also an advisor on health in the Obama administration. Currently, there is no evidence that if you are under 65 years old and otherwise healthy that a booster shot is needed. Without guidance, it's hard to understand what 3 doses will do. Is it protection out to 5 years or just another 8 months? There's still a lot of open questions currently. The Biden administration has urged the FDA to release a booster rollout plan ASAP. Many Americans, including first responders and immunocompromised people, received their initial doses early in 2020. Officials want the most vulnerable people at the front of the line for the booster shots. The FDA is currently evaluating a larger population of vaccinated Americans for when they should receive their booster shots, likely 6 to 8 months after initial dose. A plan should be announced this fall in regards to boosters. A key part is doing an independent evaluation and determination of the safety and or effectiveness of the additional doses. It is important for individuals to adhere to the FDA's recommended timing of the shot, said Dr. Patel. Like any other 3-shot vaccine series, the intervals of the shots will be gauged for the most robust immunity for the longer period of time. And in the article, it said longer, and I think it sounds better longest. But hey, I'm not writing for Forbes, so I don't get to do that. But anyways, it is inevitable for everyone to get their booster at some point. Many people preemptively getting an additional vaccine dose for additional protection at this point could be potentially harming themselves 6 to 12 months down the road. It could be a very, very dangerous assumption. So, yeah, that's, I mean, really, with there already being some vaccine hesitancy and the information kind of being cloudy on what really to trust, really, and where accurate information that's unbiased is coming from, I can relate and kind of understand why people are deciding to just go out and get another vaccine shot. What's the worst thing that could happen? But at the same time, you don't really know how that and you don't really know how that concoction of chemicals can work. You don't know if it's going to help you. Is it going to do anything at all? Is it going to just cause longer health term effects? Because there are how many times have you seen seen like TV ads that start with, "You may be eligible for legal compensation," and then they'll list a medication. Well, that medication at one point was FDA cleared, so it's was it the right thing at the right time, or did they realize oh dear, they fucked up? We need more information, and it's COVID's with it spreading as fast as it is. I mean, shit, I was on my phone earlier and I've heard about the Delta variant and then this another variant I just heard about, which is like insane. That's crazy. Like this coronavirus is just popping off left and right. It's insane. So we'll get these Forbes articles up about. So yeah, so the one I went over that I kind of talked about was a Forbes article. Some vaccinated travelers are already getting COVID-19 booster shots, but experts say they may be counterproductive. That was posted September 3rd, 2021. Um, it's pretty short article, just from Forbes. So take it or leave it, I suppose. It doesn't really seem like there's no real, it doesn't really seem like there's any political bias to it. It just seems like just information being shared. And it seems to be pretty, okay, seems to be pretty worth the read. And I'll put that up on the screen for a little bit here. Okay, so now move over to my the next article that I had along with that. Uh, CDC will require travelers to test negative for coronavirus before flying into U.S. from abroad. That was posted January 12th. Holy cats! Okay, that's a little bit older, but yeah, that's the information about travelers coming into the United States. Let's see. Yeah. Effective January 26th, all air passengers will be required to take a viral test within 3 days before their flight to the U.S. departs and must prove the airline either documentation of a negative laboratory test result or proof that they have recovered from a coronavirus infection. Airlines must deny boarding passengers if they do not provide a negative proof, provide proof of a negative test documentation of recovery or refuse to take a test, the CDC said. With the U.S. already in surge status, the testing requirements for air passengers will help slow the spread of the virus as we work to vaccinate the American public, the CDC said in a statement Tuesday. Um, so I'll leave this guy up on the screen here for a little bit. Okay, so it definitely is kind of I want to say a little frustrating in some regards. With I don't even want to say it seems like HIPAA violation, and I don't even want to say HIPAA violation, but just why are we asking people like medical questions? Have you recovered from this? Um, and I know it can be pertinent information, but like when it's there has never been a time where uh, even like when I was a kid with H1N1, that that affected kids, and I was still in school. Um, you know, this whole lockdown, shut the whole country down, destroy the economy of the world. Uh, that didn't happen. I don't know what the fuck. It was very confusing. This whole uh, this whole pandemic has just been nothing but confusing, especially just being a little guy, just doing little things. Um, get onto my last article here. This is my another Forbes article here. Uh, if it wants to load, um, I just have a bunch of tabs and stuff open on my browser on this MacBook I'm borrowing. So this was posted August 31st, 2021 on Forbes. Here's what to do if you test positive for COVID-19 while traveling outside the United States. I didn't really read much into this one. I know I kind of read the title a little bit, but I should probably read a little bit more of it. If you're planning an international trip these days, it's fairly decent that you get stuck in your destination for longer than you planned, and you should definitely have contingencies in place for this possibility. Regardless of your vaccination status, you must test negative for COVID 19 within 72 hours of boarding a flight to the United States. If you test positive, you cannot re-enter the U.S. until you test negative again, however long that takes. Testing positive before the return flight home, an occurrence that is becoming more and more common among international travelers. Travelers will not only delay your return, but it will also add significantly to your costs. Your U.S.-based health insurance plan is unlikely to cover medical expenses and abroad, and you will have to rely on resources in your destination. This is why it is so important to buy pandemic-specific travel insurance before you leave home, and that's why some countries require foreign tourists to carry it. Man, I'm gonna leave this one on the screen for a while, and I'm gonna take a little bit of a break from recording, and then we'll get right back. Hey guys, so I'm back from getting some food, and dang, I definitely feel a lot better. Starting to, I had a little bit of a food aversion issue kind of going on for a while. I think from stress and a variety of other things, and I'm definitely excited and happy to have my appetite for food back. It's oh god, it's such a nice thing. But now the last article I'm gonna talk about, and we'll get that guy. Thankfully, I got let's see, two articles about this one. The one that I did my short little bit on is from Newsweek. Was posted. Just gonna mute this fast, just in case there's any audio playing. It doesn't. Okay, just in case. Anyways, so it was posted on Newsweek. Come on. On September 1st. Children dying very quickly as a mysterious fever kills over 60 people in 1 week. At least 68 people have died in 6 districts located in the eastern part of the state of Uttar Pradesh in India last week due to the fever. According to the Times of India, the deaths promoted Yogi Adityanath, the area's chief minister, to increase the bed capacity at hospitals, according to the Independent. Adityanath also asked the health department to conduct a detailed investigation to the illness, which is described as a mystery fever by many local newspapers over the past week. According to BBC News, the patients infected with the mystery fever suffered from dehydration, nausea, joint pains, and headaches. Many others also complained of rashes spreading across their arms and legs. And that sounds unpleasant as fuck, but I mean, it'll kill you, so that's more of the worry there. Currently, of the people who have died, none tested positive for COVID-19. Many physicians in the area have suggested that it may be dengue fever, a viral infection commonly spread by mosquitoes in India. In the span of a week, the illness has been reported in the Guinea, Agra, Mathura, Manipuri, Itath, Kasganj, and Firozabad districts. Yeah, I didn't really look that up ahead of time, but I'm starting to. I'm gonna see if I can work off my feet. We're doing this stuff one take. Doing just one pass at this, and I really just want to record this one time, and edit the little bit I need to, and just leave it raw as I can, because that's where it's fun for me. Dr. Natita Kusiresla from Firozabad told the BBC that the patients, especially children in the hospitals, are dying very quickly, while Dr. Sangeeta Anisha, the principal and dean of the autonomous state medical hospital in the region, told The Hindu some patients are testing positive for dengue fever, not all are. That's, with COVID going on and the different variants, because I think, if I remember correctly, the Delta variant originated in India, I think. And with everything going on over there and such a large population, a lot goes out to anybody who lives in India right now. I really hope you're doing okay, because there's a lot going on, and it's it's stressful and it's kind of scary, just walking out your door some days. And with all these viral diseases and sicknesses that are getting around, man, it's starting to do a number. It's starting to do a number. It's crazy. I'll see if we can. All right. The Independent reported that in response to the mystery behind the cause of the illness, which was first detected on August 18th, Adith Yaneth said that an investigation would be carried out with form teams formed to conduct a probe. Due to lack of awareness at the local level, the patients were taken to private hospitals and clinics, he told the reporters. After learning about the fever, the health department and administration appraised authorities of the situation at the state level. Directions have been issued to ensure adequate manpower at medical colleges. Newsweek has contacted the health department in Uttar Pradesh for comment. So it doesn't look like there's any comment on that. And then I have, I'll leave that one up on the screen for a little bit. Okay, you probably heard my cat's feet as well. And then I got another one that's a lot more in depth that I'll read a little bit more on from the BBC. BBC News. This was posted 3 days ago, so probably the September 1st, it looks like, from an Indian correspondent, so local reporter. For more than a week now, children in some districts in the northern Indian state of Uttar Pradesh have been waking up with high fever, drenched in sweat. Many of them have complained of joint pains, headaches, dehydration, and nausea, and in some cases they reported rashes spreading across the arms and legs. At least 50 people, mostly children, have died of the fever, and several hundred have been admitted to hospital in 6 districts of the eastern part of the state. None of the dead tested positive for COVID-19. I mean, I know it's a pandemic, but like, does everything have to be COVID related? I mean, just asking a question. Because, like, yeah. Anyways. At a time when India appears to be slowly recovering from its second deadly wave of coronavirus, the deaths in Uttar Pradesh have provoked a rash of panicky headlines about a mystery fever sweeping through the countryside of India's most populous state. Physicians in a few of the affected districts believe dengue, a mosquito-borne viral infection, could be the cause of many deaths. They say many of the patients were taken to hospital with declining platelet blood component, which helps form clots count, which characterizes a severe form of dengue. Man, this is... Okay, so here's they list the mosquito. The mosquito, and it's... I'm not very good with Latin, so give me a second. Aedes aegypti, I think, breathes in and around houses and containers holding fresh water. Humans provide breeding places, and only humans take them away, says Dr. Scott Holstead, one of the world's leading experts on viruses spread by mosquitoes. Nearly 100 million severe cases of dengue severe bleeding, impaired organs are reported worldwide every year. The combined impact of COVID-19 and dengue epidemics can potentially result in devastating consequences for populations at risk, according to the WHO. And I'm not really going to read more on this article because I'm not the one that wrote it. But man, that's holy cats. That's crazy. That's scary. I really hope there is some help and some answers and something figured out for that. Because that's a really big hit on populations, and it's scary. I think. I don't know. I don't really know what it is. I don't really know what anything is anymore, to be honest. But yeah, I'll list the 2 articles. I'll have those up on the screen for a little bit. Actually no, I got one more. Speaking of which, before I go into that, edit, Control Command C. I had one from the Indian Pediatrics. Indian Pediatrics website. Okay, so this is about if it wants to load faster. I like cheese pizza. That's just some weird. I don't even know what I'm doing. I just have some weird kind of nicks, just tick kind of things I like to do every once in a while when I'm bored. I have really bad ADHD, and I have I also have tinnitus, so I like to constantly talk, so I don't hear I don't get ringing in my ears because that's not enjoyable. But okay, this is okay. So it's short communications. I don't remember. Was this in? I don't even remember. So this was, and I'll post just because it looks like a 4-page short communication about a poisoning that occurred in India as well. Um, I don't remember exactly what was associated with this. I think it was. Okay, so it looks like it was. It's relevant to just an outbreak of something else that occurred in the western Uttar Pradesh area. Cases occidentalis poisoning causes fatal coma in children in western Uttar Pradesh, and it's a short. It's a 4-page communication. Many outbreaks of acute childhood illness with severe brain dysfunction, other than Japanese encephalitis (JE), occur in different parts of India. They may be different diseases at different times and places. Western Pradesh is noted for annual seasonal breakouts of what is called encephalitis. Despite several investigations by public health agencies, no viral agent has been detected, yet they are presumed to be viral encephalitis. We found the disease neither infectious nor encephalitis, but a hep, heptomycin mouthful syndrome pathology something syndrome. Pathology excluded infectious nature, but suggested toxic cell necrosis with little inflammation. Circumstantial evidence pointed to plant toxin as the probable cause. We conducted a case control study of risk factors and found significant association. We found a significant association with the exposure to Acacia occidentalis, Coffees sienna, common name, Casodina pomade or Hindi. The plant grows luxur, lux, luxuriantly in western UP, with flowering season in August and September and seed pod seasoning in September December, correlating with the seasonality of outbreaks. Okay, so that's I mean that's it's information and it's something to go from, and obviously it's not directly correlated to what's going on um, with the current possible dengue fever and with it being called the mystery fever. There's no real 100% connection between the two, but it is it shows a pattern that in India, especially in Uttar Pradesh, that outbreaks occur a lot and that sickness and stuff occurs a lot. And my personal opinion is that it might be to just be with the population density and how many people are in an area, because when a virus or bacteria can get into one person and then you build an immunity against it or a vaccination against it, you can either defeat it or it will advance and evolve and become eventually some viral diseases or some infectious diseases are just immune to any sort of treatment, which is that's when it gets real scary. But man, it's getting a little bit late. I think I'm gonna wrap it up with this news segment. I've really enjoyed kind of talking about it. We're gonna get this all edited up, and I'm not really sure what date I'm gonna get this posted. However, I'll let you guys know ahead of time, and I'm gonna try figuring out a pretty regular schedule. The next thing I have up on the docket actually was some articles I would really like to look into that girlfriend had told me about, and they were some other interesting reads involving using CBD and hemp with COVID-19 treatment, which I think is, whew, well, that's a lot better than just some cocktail concoction, in my opinion. But hey, take it or leave it. Anyway, guys, thank you guys so much for listening, and stay tuned for the next installment. Thanks.